Welcome to the special edition of Neurology News Network. I'm Marco Meglio. Please excuse our appearance this week as a majority of the U.S. workforce, including the Neurology Live team, moves to working remote as we come together to help reduce the spread of the novel coronavirus. First up, findings from a recent study conducted at Cleveland Clinic that assessed a pocket card algorithm for the multidisciplinary treatment of status epilepticus suggest that the pocket card is a feasible, effective, and valuable educational tool for clinicians on these teams. The data showed that interdisciplinary teams who had the pocket card available to them had shorter times to rescue therapy and similar rates of adequate dosing. At 9-month follow-up, 81% of survey respondents reporting they had the pocket card available consistently. More nurses and advanced practice providers than physician trainees. Notably, lead author Jessica Fessler, a staff epileptologist at the Cleveland Clinic Epilepsy Center, and colleagues wrote that this card could improve the implementation of updated guidelines for the treatment of status epilepticus. They added that the frequent inappropriate dosing and timing of benzodiazepine relates to poor outcomes in status epilepticus and necessitates new methods of educating care items, implying that the pocket card may help fill a role. Next up, we have pooled analysis from 2 randomized studies and a 12-month open-label study presented at Sleep 2020, which demonstrated that treatment with the maximum recommended dose of pitolisant did not show any cardiac safety signals. Winter and colleagues documented a mean change in heart rate from baseline to end of treatment of negative 0.5 beats per minute with pitolisant and negative 0.2 beats per minute with placebo. Additionally, they found that the mean change for both systolic and diastolic blood pressure were both similar in pitolisant versus placebo. Because cardiovascular diseases are comorbid in patients with narcolepsy, cardiovascular adverse events become a concern for those who take medication to treat their sleep condition. Heart rate increase, right bundle branch block, and palpitations were among the cardiac AEs observed in treatment with pitolisant. Blood pressure increase found in one patient was the only cardiac AE observed in the placebo group. Data from a longitudinal intracerebral hemorrhage cohort study revealed that selective serotonin reuptake inhibitors, or SSRIs, are associated with both improvement in depressive symptoms and increased risk of recurrent hemorrhage stroke in patients who survived prior ICH. SSRIs were also associated with an increased risk for ICH recurrence in those who were at high risk for recurrent ICH to begin with, compared with all other survivors of ICH. Notably, patients with high-risk recurrent ICH and all other ICH survivors did not differ in terms of depressive symptoms associated with SSRIs. Alessandro Biffi, neurologist at the Institute for Brain Health at Mass General Hospital, and colleagues noted that clinical history, neuroimaging data, and genetic biomarkers may help identify survivors of ICH more likely to safely tolerate SSRI use. And for more direct access to expert insight, head to neurologylive.com. This has been Neurology News Network. Thanks for watching.